So Project Echo actually started a long time ago. I think it was 2004, maybe 2003. It started by a hepatologist at the University of New Mexico. His name is Dr. Sanjeev Arora. And he actually has this study on their Project Echo website. So if you're interested in finding more, but I'll tell you about it because this is exactly how the project started. He saw a patient in his clinic who was a widowed mom, and she was about 43 years old or something like that. And so she came to see him and she had liver cancer and she was diagnosed with hepatitis C about 8 years prior, but she did not have good access to a hepatologist. She lived in a rural, isolated area and wasn't able to travel. But unfortunately, by the time, 8 years later that she came to see him, there was nothing that he could do. And she ended up passing away. And so after she passed, he was very moved by the story, and she probably wasn't the only patient that he saw that had a hard time reaching necessary care. And so one of the things that he did is he reached out to those primary care providers in rural communities and started talking to them about, what can we do and how can we support you so maybe you can take care of these patients in your own community. And initially he shared the protocol, but he realized that that's not enough. And so Project Echo is really developed on adult learning theory, which is, adults learn different than children. They learn by a model that we call it see, hear, and do, by modeling, by mentoring, and applying that knowledge and sharing experience. And so that's what ECHO is about. And he did a study around hepatitis C, and this study showed that patients that were treated by primary care providers did just as well as those patients that they were treating in academic medical center when providers participated in ECHO. So they received mentoring and guidance. So each ECHO session has sort of two different parts to it. One is expert didactic lecture on that specific disease or condition. And the other part of ECHO is case-based learning. Primary care providers can bring up de-identified cases, ask questions in these cases, and everybody, it's all teach, all learn platform as well. So anybody can share their opinion, their experiences, and provide guidance on what the best course would be for that patient. And the primary care provider will go back and continue treating the patient based on what they've learned in ECHO session. So our study was really all about access to care, making sure that patients that were seen in our clinic had access to appropriate diagnosis and treatment. So what we did is we did a concordance study. We analyzed diagnostic accuracy of primary care providers who participate in ECHO and also treatment accuracy. And our study only validated other studies on concordance in literature. So typically studies on PCP, primary care clinician, and dermatologist accuracy show accuracy anywhere between 20% and 70%. Most of the time, concordance depends on the specific diagnosis. It's typically lower in skin cancers and higher in acne and some viral skin conditions. We found diagnostic accuracy to be right at about 40%, which validated these other studies because we included different conditions, all different kinds of conditions that were presented in ECHO. But really the main takeaway from our study is that all of the patients that were presented in Derm ECHO received updated diagnosis without the need to travel to a dermatologist, without a need to be referred, and everybody learned about those diagnoses and treatment. So I think the main takeaway is access to care, that ECHO does improve access to care, and that this is a learning platform for primary care clinicians, especially those that work in isolated and rural areas where patients do not have adequate access to specialists.